Hello. All right. Hello, everyone. Okay, let's see that. Hello. Can you guys see me? We're good? Awesome. Welcome to NCLEX Jeopardy, the last NCLEX Jeopardy of the year. Right? I know. We will continue this in 2024, of course. But hello, my name is Nurse Sam. I create fun resources and study guides for nursing students in order for you to pass the NCLEX, retain more information in less time. And one of the ways I love doing that is by gamifying everything. So we created NCLEX Jeopardy. This is just our fun review of NCLEX style practice questions in a slew of categories right here. We're going to have pharmacology, pediatrics, fundamentals, adult health, and mental health. We're going to have some of those questions. And we're just going to review it like we would regular practice questions, but just in a fun way, right? It's not as overwhelming and not as daunting, and adds a fun little competitive edge to it. So how we're going to play is I'm going to select a question with a amount or a point amount. Let's say pediatrics for 300. It's going to be worth 300 points. You're going to see the question. You're going to see the answer choices. You're going to comment in Jeopardy style. So you're going to say what is and then whatever that answer is. So it's usually going to be 1, 2, 3, 4. It's like listed multiple choice. So you would say what is 1 if you think the answer is 1. What is 2 if you think the answer is 2. So on and so forth. Okay? If you want to play for points, okay, to win a free prize at the end if you get the highest score, if you want to play for points, make sure you say what is. Okay? If you don't want to play for points and you're just here for the review to have fun and you're bored at home, sure, welcome. Go ahead and play. Just don't put what is so I know not to count. All right? So if you guys have any more questions as far as the house rules, go ahead and comment them below, but give me a thumbs up if you are ready to get started. We'll start our first question. Thumbs up if you are ready to get started with our NCLEX Jeopardy review. All right. Let's go ahead and get our first question. And let's start with pharmacology. Right here. Pharmacology for 300. I'm going to move my head out the way, okay? I'm up here. All right, so pharmacology for 300. A client in the post-anesthesia care unit, or the PACU, has a prescription for droperidol, sorry. The nurse determines that this medication has been prescribed to treat which condition? Is it 1, pain, 2, nausea, 3, headache, or 4, confusion? What is our answer? First person to get it correct will win the points. This is pharmacology for 300. NCLEX Jeopardy with Nurse Sam. A fun review for your NCLEX as well as your next semester. All right? Remember to say what is if you want the points. If you're just here for the review, just say what you think the answer is. All right? What is our answer? Droperidol. That medication is used to treat which condition? Let's see, I'm saying 2s and 1s. So y'all are between pain and nausea. All right. Let's see what that answer is. Not me. All right, you guys ready? And our answer for pharmacology for 300 is... what is 2? Nausea. Droperidol is an anti-emetic and is used to treat nausea. It is not used to treat the conditions in the other options. So pain was not the answer. It is 100% what is 2? Nausea. Great job. Great job. If you got one, that is okay. Like I said, this is just a fun review, no pressure. Okay, that's the whole point of why we do NCLEX Jeopardy. To take away the pressure. If you get it wrong, oh well, at least you learned what it is so that next time when you do see it, maybe it's going to be on the NCLEX, maybe it's going to be on the exam. Now you know what it is. All right. So the person that got the answer first is Jasmine McNeil 408. Hey, Jasmine. Congratulations. You are now on the scoreboard with 300 points. All right. Now let's go ahead and get the next question. All right. We just did pharmacology for 300. Let's do pediatrics. Pediatrics for 200. I'm going to read it. If it's cut off a little bit, I apologize. I'm going to read it as well. It says, pediatrics for 200. The mother of an 18-month-old child tells the clinic nurse that the child has been having some mild diarrhea and describes the child's stools as mushy. The mother tells the nurse that the child is tolerating fluids and solid foods. The most appropriate suggestion regarding the child's diet would be to give the child which item? 1. Applesauce, bananas, wheat toast. 2. Mashed potatoes with baked chicken. I'm getting hungry. 3. Gelatin, strained cabbage, and custard. No air. Or 4. Fluids only until the mushy stools stop. What is our answer? Little study strategy trick really quick. Whether it's the NCLEX, the pharmacology ATI, don't know, don't care. In an exam, especially for nursing school or the NCLEX, you want to read the full answer, well, the full question and the answer choices straight through. All right, read it one good time, nice and slow, so you don't miss anything. And then after you read the whole question and all the answer choices, go back and at least read the last line so you can remind yourself of what the question's actually asking you. Okay, in this case, the most appropriate suggestion regarding the child's diet would be to give the child which item. I'm seeing a bunch of ones, so let's go ahead and see what our answer is. All right, so this is pediatrics for 200. And the answer to this question is, what is 2? Mashed potatoes with baked chicken. Ooh, I saw lots of ones. Let's see. Anyone got a 2? Fat bottom said 2. A lot of ones. I got some 4s and 3s. Not a lot of people said 2, but it's okay. Let's figure out why, okay? Again, that's why we do this. So the answer was 2, mashed potatoes with baked chicken. It says the continued feeding of a normal diet can prevent dehydration, reduce stool frequency and volume, and hasten recovery. Common foods that are especially well tolerated during diarrhea are bland but nutritional foods, including complex carbohydrates such as rice, wheat, potatoes, cereals, yogurt containing live cultures, cooked vegetables, and lean meats. So the foods in options 1 and 3 may actually worsen the diarrhea. Fluids only will affect the nutritional status, so that's why that one wasn't the answer. All right? You guys got that? That was a good one, right? That's why we do practice questions. Okay? All right. Someone said, always pick the baked chicken. That's actually pretty accurate. All right. Now let's go ahead and get to the next question since nobody got that one saying what is. But I think Fat Bottom got it and just said 2, but didn't say what is, so I'm assuming you don't want the points. It's fine. Let's go ahead and get to the next question. All right. Now remember, the actual the actual NCLEX is not Jeopardy style, so it doesn't matter if you're 200th place or 5th. It doesn't matter. As long as you get the answer right in the allotted amount of time, you're good. All right. So next question. Let's do mental health for 400. Mental health for 400. All right, it says a newly admitted client is exhibiting signs and symptoms associated with a loss of physical functioning, although no such loss can be confirmed medically. This situation supports which mental health diagnosis? Is it 1, depression, 2, somatization disorder, 3, post-traumatic stress disorder, PTSD, or 4, obsessive compulsive disorder, OCD? All right. This situation supports which mental health diagnosis? What situation are they talking about? Now you go back and you find that answer in the question. A loss of physical functioning, although no such loss can be confirmed medically. That's all you need to know in order to get this one. Okay? Let's see what you guys are saying. Twos. Got some threes, twos. Got a 4. Okay, cool. I love a good healthy debate. A good healthy debate, right? All right, let's see what that answer is. You guys ready? Or you need a couple, any more time, or are you good? Well, by the time I find the answer, let's go. All right, let's see what our answer is for mental health for 400. And the answer to this question is, what is 2? Somatization disorder. Great job. A lot of y'all were between 2 and 3. Great job to the people that got 2s. If you didn't get 2s, make sure you read the rationale so you understand why the answer is 2 and not 3, or whatever answer you got. Okay? First person to say what is 2 is, wait, hold on. Wait for it. Carla, you said 2. But Lacey is the person that said what is 2. So great job, Lacey, for winning the points. But awesome job to everyone else that got 2. Yo, I see you, but you didn't say 2, so I'm assuming you don't want the points. Carla Reed also said 2 first, but didn't want the points. Mima, Christina Peters, I see you. What is 2? That is the answer. What is 2? So, Lacey, congratulations. You now have 400 points. All right, so we have Lacey on the scoreboard with 400 and Jasmine on the scoreboard with 300. We still have more questions to go, so we still have some time for you guys to scoot up into first place. All right, so what is 2? Somatization disorder. Emotional turmoil expressed in physical signs is the hallmark of somatization disorder. None of the other options are associated with loss of physical function. Okay, that's usually like a trauma response. Right? See, emotional turmoil expressed in physical signs. Can someone give me an example of something that, or a common situation that's usually used, especially on the NCLEX, that is representative of somatization disorder? Put my head back up. Can anyone give me an example of somatization disorder? Amputation, like phantom pain. Or another one that we see a lot, or that I see a lot, now people tell me that they see a lot, is if, I think was it Ray? I'm not sure if it was the movie Ray, but like if somebody like sees a car accident and sees somebody like pass away and something traumatic happens, then all of a sudden they lose their sight. You know, that traumatic feeling associated with that visual all of a sudden turned off the sight, but there's no medical reason why. It's just the emotional turmoil. It's like your body does it to protect yourself. So that's somatization disorder. Plus somatization, like somat, that prefix means body, so it's usually something associated with your body, like losing limbs, like with the phantom pain specifically, or losing your voice if you're assaulted. That's a good one. Absolutely. All right, great job. Let's get into the next question. Awesome job, Lacey, for getting that one. Great job to everyone that did get it. And if you didn't get it, great job to you for trying. But now you know for next time. All right, so next question is fundamentals. Fundamentals for 500. All right, so this one, whoever gets this one, you're going to have a nice little boost. Okay, this one is The nurse has instructed a client with a continuous passive motion device applied to the leg about the device and its use. The nurse determines that the client has misunderstood one of the teaching points if the client asks which question. 1. How to use the stop go button. 2. About reporting discomfort in the knee to the nurse. 3. How to reset the degrees of flexion or extension according to comfort. And 4. Whether the knee should stay aligned with the hinge joints on the machine. What is our answer? Remember to read it fully through, question and all the answer choices. Then go back and read the last line so you remember what the question's actually asking you. All right. The nurse determines that the client has misunderstood one of the teachings. All right, so that means we're looking for the answer that is false. Okay. I'm seeing lots of 4s, but I'm seeing some 3s. 3s and 4s. All right, let's see what our answer is, or do you need some time? I think we're good. Let's get into that answer. Remember, we're looking for the incorrect answer. All right. What's going to confirm that they have a misunderstanding? The answer to that question is, what is 3? How to reset the degrees of flexion or extension according to comfort. All right. This is the incorrect statement for them to say. That does not demonstrate their understanding. Okay. It says the client should not adjust the flexion and extension settings. These settings are determined by the orthopedic surgeon and are maintained as prescribed. Okay, the client is instructed about how to stop and start the machine and about the need to notify the nurse if the client experiences knee discomfort. Those are true things. Those are actual patient teachings that are required to happen for this type of device. Okay. This is the client also should be aware of proper positioning so that the nurse can be notified if the leg slips. No, sorry. Other important actions by the nurse with use of this device are to assess the neurovascular status of the extremity and to ensure that the device is padded with manufactured disposable padding before the client's leg is placed in the device. Okay, so the answer is what is 3. This was the incorrect answer. All right, that's why I said to go back, reread, and make sure you understand what the question's asking you. All right, first person to say what is 3 is Lore. Great job, Lore. You have won 500 points and you are now in first place. All right, great job. All right, great job to everyone that said 3. If you didn't say 3, we just went through the rationale. Screenshot it if you need to. Again, this is your review, so whatever you need to do, screenshot it so you can use that as your notes for later. Doesn't matter. Whatever you need. Okay, y'all ready for the next question? How we doing? Ready for the next question? Give me a thumbs up if you're ready. Or let me know if you still need to digest this last one. Thumbs up if you are ready for the next question. All right, I'm seeing some thumbs up. Let's go ahead to the next question. All right, let's go to adult health. Adult health. All right, this is adult health for 100. Adult health for 100. It says the nurse is monitoring a client with a diagnosis of peptic ulcer. Which assessment finding would most likely indicate perforation of the ulcer? Is it 1, bradycardia, 2, numbness in the legs, 3, nausea and vomiting, or 4, a rigid board-like abdomen? Which assessment finding would most likely indicate perforation of the ulcer? This is adult health for 100. For NCLEX Jeopardy for those that are just now coming in. Hello, I'm Nurse Sam, and we are doing NCLEX Jeopardy, a free and fun review. No pressure, just a fun way to review for your next semester or your NCLEX exam. All right, we are now doing Adult Health for 100. I'm seeing lots of 4s, a rigid board abdomen. Let's look and see what that answer is. Remember, guys, and just like any review, you want to give yourself like about a minute to answer these questions, because you're going to have a little bit under or over that for the NCLEX. Don't time yourself, it's going to give you anxiety, all right? But keep that in the back of your mind. All right, so that was adult health. Let's see what our answer is. What is 4 a rigid board-like abdomen? Great job. Majority, if not all. Majority. Some people said 3s, and that's fine. But yes, majority of everybody said 4. First person to say 4, or what is 4, to get the points, was Christina Peters. Hey, I recognize you. Welcome back, Christina. All right, Christina Peters, you now have 100 points on the board. All right, so now let's read through the rationale and see what it says. So it says perforation of an ulcer is a surgical emergency and is characterized by sudden, sharp, intolerable, severe pain beginning in the mid-epigastric area and spreading over the abdomen, and it becomes rigid and board-like. Okay, it's that's filling with fluid basically, and that's what's going to create that rigid and board-like abdomen. It says nausea and vomiting may occur, tachycardia may occur as hypovolemic shock develops. Hypovolemic, low volume. All right, numbness in the legs is not associated in any associated findings, so that one just wasn't the answer. The answer is what is 4. Got it? A lot of you guys got what is 4, so great job. I said fluid, but blood. An ulcer perforation is like a hole in your stomach, basically. When does it perforate? I guess when it gets severe enough. All right, great job, guys. Let's get into the next question. That was adult health. Let's do pharmacology. Let's do pharmacology for 500. Let's make it spicy. Pharmacology for 500. All right, it says a client who is receiving lithium carbonate has a serum level of 1.8 milliequivalents per liter. Which intervention will the nurse implement in response to this diagnostic result? Which is the serum level of 1.8 of the lithium. Is it 1, plan rest periods into the client's daily routine? 2, monitor the client for behaviors that suggest ataxia. 3, document incidences that the client has begun to demonstrate mood stability. Or 4, notify the client's primary healthcare provider that the medication dosage needs to be increased. Okay, so this type of question requires us to make like 2 different steps. Okay, first they give us the serum level of 1.8 of that lithium. So we have to look into our mind and figure out what the normal range is for lithium and interpret this level right here. Does anybody know? Can anybody tell me right here what that normal range is for lithium? All right, and we also know that with lithium, we can also reach lithium toxic levels, which is lithium toxicity, which is a very important intervention when it comes to pharmacology and lithium. Right, so 0.6 to 1.2. So our level is 1.8. Something's out of bounds, right? So let's see what this answer is. It is above the normal range. And it's not a little above, right? It's 1.2 is the cutoff, and this is 1.8. It's giving toxicity, absolutely. So let's see what this answer is. Pharmacology for 500 points. And the answer is, what is 2? Monitor the client for behaviors that suggests ataxia. What is 2? Who got that? I see lots of 2s, but I did see lots of 4s. I did see some 4s. But first person to say what is 2 is Anna. Great job, Anna. You are now on the scoreboard and tied with Lore with 500 points. All right. Great job, Anna. All right. Anna was the first person to say what is 2. Monitor the client for behaviors that suggest ataxia. All right, so let's look into the rationale. It says a serum lithium level of 1.8 indicates moderate toxicity. Remember, that's what we just interpreted. That's based on the 0.6 or the 0.6 to 1.2. That normal range, 1.8, obviously above that. According to this, serum lithium concentrations of 1.5 to 2.5 that may produce vomiting, diarrhea, ataxia, which is another word for what? Incoordination and muscle twitching, as well as slurred speech. What does ataxia mean? What do they mean when they say ataxia? What do they mean when they say ataxia? Uncontrolled muscle movement, lack of coordination. Absolutely. All right. Says the therapeutic serum level of lithium is 0.6 to 1.2, which we already established, and that a level below that indicates a need for an increase in the dose. So we knew that wasn't the answer. They were already in the toxic levels. Why would we need to increase it? Absolutely not. And then it says fatigue is a common side effect of this medication. So that one wasn't the answer either. The answer is what is 2. Great job, guys. So we had to do a 2-step thing. Right. On the NGN, I believe they would give you the normal range or the normal values, depending on the type of questions, if it's NGN or just like regular NCLEX. No, they're definitely going to give you the normal range. So it's just up to you to be able to interpret it. All right. Next question. That was pharmacology. Let's do peds. Let's do peds for 100. Peds for 100. It says the nurse is caring for a newborn with a suspected diagnosis of imperforate anus. The nurse monitors the infant, knowing that which is a clinical manifestation associated with this disorder. 1. Bile-stained fecal emesis. 2. The passage of current jelly-like stools. 3. Failure to pass meconium stool in the first 24 hours after birth. Or 4. Sausage-shaped mass palpated in the upper right abdominal quadrant. Read that last line. The nurse monitors the infant, knowing that which is a clinical manifestation associated with this disorder. That's disorder meaning imperforate anus. All right. So which of these options is a clinical manifestation, aka sign, symptom, cue? Well, those are all synonyms for clinical manifestation of imperforate anus. All right, I'm saying what is 3s. I'm saying lots of 3s. Lots and lots and lots of 3s, which is failure to pass meconium stool in the first 24 hours after birth. All right. Let's see what that answer is. Make sure you guys know why. We're going to go into the rationale, but make sure you know why the answer is what it is. Because on the NGN, they do have this type of like if then or answer the question then ask, they will ask you why the answer is correct. So make sure you know why the answer is what it is. And in this case, our rationale is what is 3? Correct answer is what is 3? Failure to pass meconium stool in the first 24 hours after birth. That is the clinical manifestation of imperforate anus. All right. If you didn't know about imperforate anus and you just guessed, we're about to go through the rationale. Make sure you note this. All right. That's why reviews are so important, because it's like you're getting your assessment as well as a mini lesson / review at the same time. This is a real look at the type of questions and the style of questions that you're going to get on the NCLEX. All right. It says imperforate anus is the incomplete development or absence of the anus in its normal position in the perineum. During the newborn assessment, this defect should be identified easily on site. However, a rectal thermometer or tube may be necessary to determine patency if meconium is not passed in the first 24 hours after birth. Make sure you note that whole first 24 hours after birth, because you will get questions about this, and maybe the answer or one of the answer choices is meconium not passed in the first 24 hours, or you may get meconium not passed in the first 7 hours or something like that. That hours will be off, just to make sure you know that this is specific to not passing the meconium in the first 24 hours after birth. Okay. Then it says other assessment findings include absence or stenosis of the anal rectal canal, presence of an anal membrane, and an external fistula to the perineum. Yikes. Options 1, 2, and 4 are not findings. Are findings actually noted in intussusception. All right, which is a big one to know for pediatrics. That's a common NCLEX to know for peds. Intussusception, but we'll get into that when we get into that, because we'll have some questions on that as well. All right, did I get who got that one? The answer was what is 3? Ms. Donna, you got that one. Ms. Donna, you now have 100 points. All right. How you guys feeling before we go to the next one? Is this a fun review? Are you learning a lot? Are you surprised that you're answering the questions the way that you're answering? Are you proud of yourself? How you feeling? How are we feeling with this review? All right, you like it? Great job. Awesome. Okay, cool. You guys ready to do more? Give me a thumbs up if you are ready to do more. Feeling good? These questions are from my NCLEX Jeopardy, which you can find on campnursing.school.com. The full 20 questions. This is just an excerpt of the questions that we have. All right, so let's go ahead and get into the next question. We just did peds. Let's do mental health again. Let's do mental health for 300 points this time. All right, it says the client tells the nurse that she cannot leave home without checking numerous times that everything electrical has been shut off. Those quotes, those are her words. The client's statement supports which mental health diagnosis? 1, aphobia. 2, generalized anxiety disorder. 3, post-traumatic stress disorder. Or 4, obsessive compulsive disorder. I was like, did we do this? No, it's a different one. That client statement. She cannot leave home without checking numerous times that everything electrical has been shut off. All right? What mental health diagnosis of that is that? Everyone's saying 4, which is obsessive compulsive disorder. Let's see what that answer is. We either get it all right or we get it all wrong. We in it together. All right. Somebody said 5. You play so much. All right. Let's go into our answer. And it is what is 4. But y'all knew that already. Period. Great job. It says obsessive compulsive disorder, known as OCD. It's a repetitive behavior that interferes with activities of daily living and functioning is indicative of obsessive compulsive disorder. This repetitive behavior is not associated with phobias, generalized anxiety disorder, or PTSD, which is post-traumatic stress disorder. See, guys said I was right the first time. Don't change your answers. I think it's like an 80% chance that you were right the first time. Statistically, trust your gut. All right, first person to say what is 4, which was pretty much 99% of you. First person to say it to win these points is Nonchalant by Nature. Great job. And again, this is just because I love to gamify everything to make it fun and allow you to actually retain more, but in less time without it feeling so daunting. But on the actual NCLEX, you won't be playing for points. You can answer it whenever you can answer it. You won't have other people answering out loud or in a chat. It'll just be you. But this is just a fun way to play and review for it. Okay, so as long as you're getting those answers correct, that's all that matters. All right, Anna and Laura, 500 points. You guys are still in the lead. So let's go ahead and get into our next question. All right, and we are taking a trip into the fundamentals lane for 300 points. It says, a client is receiving a continuous intravenous infusion of heparin sodium to treat deep vein thrombosis, or DVT. The client's activated partial thromboplastin time, or APTT, is 65 seconds. Note that amount, 65 seconds. The nurse anticipates that which action is needed? 1. Discontinuing the heparin infusion. 2. Increasing the rate of the heparin infusion. 3. Decreasing the rate of the heparin infusion. Or 4. Leaving the rate of the heparin infusion as is, where it's at. Don't touch it. It is unchanged. Okay, so that APTT time, or that APT time, is 65 seconds. Remember our 2 steps. Whenever we get values like that, we have to interpret it. Is that normal? Is that low? Is that too high? Okay, so does anybody know the time for APTT? If you don't, that's fine. Again, on the NCLEX, they're giving you the normal lab values, so at least that. But again, you have to know what that means. Even if that is high or low or whatever it is, what does that mean for the patient? What does that mean for you as the nurse as far as your intervention to stop that from happening or to keep that patient as safe as possible? What is that answer? All right. And that answer is, what is 4? What is 4? I'm seeing lots of 4s, actually. Ooh, a lot of people said like 1s, 2s, again, which is fine. I'd much rather you get them wrong here with me on a random Thursday night than on the NCLEX. You don't get that do-over. We do this every Thursday at 7 p.m. You can get it as wrong as you want. Because at the end of the day, you're still going to learn what it is. So that next time, you know what it is. Right? Exactly. All right, first person to get what is 4 is Bruce. Bruce, Omogho. Hello, hello. You are now on the scoreboard with 300 points. Great job, Bruce. And great job to everyone else that got what it's for. Let's get into why. I'm sure you're reading it already, but let's get into the rationale so we know for next time exactly why the answer is leaving the rate of heparin where it's at. All right. It says the normal APTT varies between 28 and 35 seconds. All right, and that's depending on the type of activator that's used in testing. All right, and also as far as nursing students, as you guys go, the rate of whatever lab value may differ slightly in numbers, very slightly, based on whatever lab your textbook or your school, your program is using. So it may differ. Some may be 28, some may be 27, 29, but it's still within that general range of therapeutic or normal. It says the therapeutic dose of heparin for treatment of DVT or deep vein thrombosis is to keep the APTT between 1.5 and 2.5 times normal. So that when they say normal, they means times that 28 through 35. So if we take that 28 times 1.5 and do that, we see that the client's value should not be less than 42 seconds or greater than 87.5 seconds. All right, so thus the client's APTT is within that therapeutic range, so we left it alone. Okay, it remains unchanged. But you guys knew that. Great job. If you didn't, now you know. Okay? It's 1.5 to 2.5 times the control value, which is 28 to 35 seconds. So you would just multiply that. And that gives you that 42 seconds to 87.5. All right, so next question. Y'all ready? Next question. I think we have like 2 more questions, I believe. Nope, we have 1. All right, so this is adult health, I believe. Let me look. Yes, adult health. This is our last question. Adult health for 300. This says the nurse is performing an assessment on a client with a diagnosis of Meniere's disease. The nurse anticipates that the client is most likely to report which symptom during an acute attack. So 1, fatigue. 2, tinnitus. 3, headache. Or 4, insomnia. That client has Meniere's disease. What do we know about Meniere's disease? And based on what we know about Meniere's disease, which of these 4 options is a symptom, a known symptom of an acute attack of Meniere's disease? All right. I'm seeing twos, just twos. Majority, 99% of you saying twos, which is tinnitus, which is another name for what? What does tinnitus mean? Answer that as I put in the question. The answer, I mean. Here we go. What is tinnitus? Absolutely. Great job. Ringing of the ears. Tinnitus is ringing in the ears. Meniere's disease results in a disturbance of the fluid of the endolymphatic system. The cause of the disturbance is not known. Attacks may be preceded by feelings of fullness in the ear or by tinnitus, which is ringing in the ear. Fatigue, headaches, and insomnia are not associated with this disorder, so we could X those out. It was tinnitus, absolutely. Let me see. You said farm, that's a good way to remember. Savagery, what do you mean farm? What do you mean farm? Let me make sure that was the last question. What? It was. That was the last question, guys. Yay! Was that fun? Again, we do this every Thursday. NCLEX Jeopardy. Every Thursday. But if you guys want to play the full 20 questions, we have 5 categories. If you want to play the full 20 questions, we played about like 10 or maybe even less. So probably about like 10 or less. If you want to play the full 25 questions, because there's 5 questions per category, each ranging from 100 points to 500 points. Make sure you sign up for Camp Nursing School, which is where you can find the actual interactive game, so you can play on your phone or on your computer by yourself, with a friend, a study group, whatever. Or you can watch the replay to this live in Camp Nursing School, along with like 50 others. All right, 50 other replays already loaded in there for you. We'll have 25 new questions every week. And we'll be here on live every Thursday at 7 p.m. right here on my TikTok live. That is at the Nurse Sam 1, right here on TikTok. On that other app that starts with an I am at the Nurse Sam. And make sure you check out my study resources at thenursesam.com, including the Ultimate Nursing School Bundle 2.0, which supports all the NCLEX Jeopardy questions. It's our visual study notes. So you can go ahead and associate all that information with a visual, so it can retain all in your mind, retain all that information in longer, in less time. All right, so make sure you check that out, thenursesam.com. Make sure you check out campnursingschool.com to play NCLEX Jeopardy and watch the replay. And I will see y'all right here next Thursday at 7 p.m. All right, thank y'all. I'll see y'all next week.